If the jaw's in the wrong position, that's a real structural problem. You're compressing the nerves and blood vessels at the back of the joint and causing all kinds of problems.
And so the click we hear when you open your jaw and you hear it goes
Right.
pop, what we're hearing is that disc is now, like in this picture, gone to the forward of the bone.
Right.
So instead of the bone sliding on it smoothly when you open it, the bone's going clunk up on it
Yeah.
and pop back off of it.
That's right.
So if you have popping of the jaw, whether you've noticed any other symptoms at all yet, it's probably a good idea to go check.
Usually patients who click will have some symptoms. So they have to, but a lot of patients think that their headaches are caused by stress.
Do you find that most people, I do it, we have a tendency to make excuses for why we feel the way we do? I mean, if I put my hand on a hot stove, I yank it off, I run to get something to fix it up.
That's an acute problem.
Right, but my neck starts hurting, I think, well, I'm stressed out, I slept wrong.
Right.
Do you find that most people don't even realize
Oh, yeah.
what they can fix by getting proper treatment?
Absolutely. People have ring in the ears and they just have to put up with it. People have headaches and they just learn to live with it. And when they go to some professionals, they tell them, we don't know what's wrong, so I guess you're going to have to live with it. But I would recommend that if they have headaches or ring in the ears or dizziness or fainting or any of these problems, stuffiness in the ears, neck pain, shoulder pain, that they go see a dentist.
Lower back pain?
Lower back pain. Go see a dentist who likes to treat TMD, because not all dentists do.
Right.
Go find a dentist that has taken some courses in TMD and likes to treat it, because there are lots of dentists around that do treat it, and they just have to find one, and they can check with the American Academy of Craniofacial Pain website, and they'll find a dentist in their area that can help.
All right, when we come back, we're going to talk about treatments for it and how simple it is actually to take care of once it's been diagnosed. We're in studio with Dr. Rondeau. We're discussing TMJ. We'll be right back.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Welcome back. We're in studio with Dr. Rondeau talking about TMJ. All right, before we went to the break, we were talking about what it is, what causes it, looked at some photos. I want to take a real quick look at a video you brought that shows what goes on with TMJ, and then I want to talk to you about treatments. So first, let's take a look at the video. All right, this is a video of a TMJ joint,
Right.
which is just your jaw joint. The lower
Right.
red line is your mandible that goes down. The upper red line is just the plane of your upper jaw.
Yep.
All right, so is that, what's in the yellow? Is that a fat pad?
The yellow is the nerves and blood vessels behind the jaw, and the jaw has to be more downward and forward. The farther back the jaw goes, the more those nerves and blood vessels are compressed.
Kind of like the picture,
And
where the
more
disc could come off and push the jawbone back.
Yeah, the more they're compressed, patient's in a lot of pain, And if you don't fix that, you'll probably never get rid of a patient's headaches. You'll also get rid of migraines. A lot of patients think they have migraines, and all the time it's a tension headache due to the jaw being in the wrong position. What happens when the jaw is in the wrong position, the muscles that support the jaw go into spasm, and when they go into spasm, that's what causes the tension, and that's what causes the headaches. It's the spastic muscles seizing up that cause the headaches. So we have to fix that problem. We've got to get the jaw forward.
Well, I don't know that you would know this. I read something the other day that said that most migraine medicine doesn't, I don't want to say work, but has a very little or no effect on migraines. I have a couple friends that are migraine sufferers who have the medicine, but I know when they have a migraine because they don't answer the phone, their house is dark, they're locked in a room
Right.
somewhere, no light, and I said, well, don't you take your medicine? They go, it doesn't work. Obviously, for some people, it probably works really well. But is the reason maybe it doesn't work is because we're not treating the cause? We're just masking the symptom?
That's right, and maybe the migraine is not a true migraine. Maybe the headache that they're having is a TMJ headache, a jaw joint problem, rather than a migraine. So therefore, migraine medication doesn't work for TMD problems.
All right, well, let's use the video real quick and see how the jaw joint can collapse on that. Now, this is a normal jaw joint. Just slides out over the disc. Now, is the orange is the disc?
The orange is the disc,
Okay.
and that has to be between the two bones at all times.
Okay.
And there should be no noise and no clicking and no discomfort.
It's just a nice, smooth slide.
Right.
All right, and then what starts to happen?
Well, then the jaw goes back too far. When the jaw goes back too far, it not only compresses the nerves and blood vessels and causes pain, but the disc slips in front.
Okay, and then you start to get the little pop.
When the disc slips in front, and then when the patient goes to open, to talk, or to chew, the jawbone slips over the disc, and you hear that pop.
Right there.
Right there.
And then what happens if you said it's it's a degenerative disease, it just keeps getting worse?
Yes, there's 5 stages
And what happens
of disc displacement, and eventually, when it goes up too high, if the patient has a real deep overbite, it'll perforate the ligament behind the disc, and then the jawbone hits the skull bone, and you get terrible noises called crepitus or cracking noises, very loud noises when the patient opens and closes, because the protective disc is gone, and now the jawbone starts to wear down. The jawbone, actually, you can see, instead of being nice and round like it is there, it starts to flatten off, and the patients really, that's when they get into advanced degenerative osteoarthritis, that's very, very painful and very, very serious. So you want to fix it when it's early, and that's why I try to get my patients to come in when they're getting their headaches and they're clicking and they're having inability to open their mouth and they have these beginning signs. They should get in and get that fixed. All we have to do is reposition the jaw. I can reposition the jaw with something as simple as this. Little splint that goes over the lower teeth.
So no headgear, no...
No, just a little splint goes over the lower teeth, and we move the jaw forward and have the patient bite into this, and they have to wear that all day long.
Can you see it? Is it
No, you can't see it.
So they go about their regular day, it's in there.
I'm wearing one now. Have you seen it?
You're wearing one right now?
I'm wearing right now, right there.
Well, I can see it now. Yeah, absolutely. And that's it.
I can talk fine. I eat fine. But my jaw was off just slightly.
Are you
So
say
I'm
you
wearing this.
practice what you preach?
I try to practice what I preach.
All right,
Absolutely.
let me ask you, people come into you. Obviously, you know, I deal with all kinds of doctors. I deal with a lot of quote-unquote pain management doctors. And I've come to understand that, you know, obviously in their heart they're doing what they feel is best. They're wonderful human beings. But basically what they're doing is deadening the nerves so you don't feel the pain. So the problem's still there, but you just don't feel it anymore. You're telling me with this, not only you eliminate the problem, but there's no medication, no drugs?
That's right. My patients don't need medication or drugs. Once I get the jaw in the right position and solve the problem.
Have you had patients that have been on pain management or have had problems that have come in and seen you and been able to get off of them?
Some of them come in with 10 different drugs they're on. And my objective was in 4 months to get them off all medication. And usually we're very successful, except for a patient that's had surgery. I mean, sometimes the oral surgeon will go in and cut the jaw right off. They cut the jawbone right off. Well, those are pretty tough cases to treat. And
now, you know, I wasn't going to bring that up, but you mentioned it, and I know, and I had the occasion to speak to a gentleman who had done 800 surgeries where they basically, I don't know if they cut it all off or they cut it back, the condyle, and I just talked to him and I said, you know, how does that work? And he said that, you know, 10 to 15% of the people, it works great. That's what he said to me. And I said, well, what about the other 85? And he said, well, it doesn't always work the way we wanted it to. But once you get surgery, once somebody physically goes into your body and cuts something out, you can never change that.
it's very difficult to treat. I have had to treat some of those patients, and I have helped some of them, but it's very difficult.
With an oral appliance, before I have surgery,
Right.
if I put that in and it doesn't work for me, I can just take it out.
That's right. So
It hasn't changed anything.
that's right.
If you're going to go get checked by somebody for TMJ, there are a few things you should make sure they have. And one seems to be the proper equipment.
I just want the dentist to take x-rays of the jaw. He can either have the equipment in his office, or she can have the equipment in the office, or they can have